All right, good morning and welcome to the Thursday, March 4th COVID-19 Response Media Briefing. I'm Frangie Mays, your facilitator for this event. I'd like to welcome our panel for today from the Washington State Department of Health. We have Dr. Umair A. Shah, Secretary of Health, Lacey Fehrenbach, Deputy Secretary for the COVID-19 Response, and Sheann Allen, COVID-19 Vaccine Director. To begin today's briefing, we'll open with remarks from Secretary Umair Shah. I apologize. It's like we are having a little technical difficulty. Hold for just one moment. All right, good morning, Dr. Shah. Do we have audio and video for you?
Having some trouble with my video, but give me one sec here. But audio is obviously working.
Yes, thank you. Let us know if you'd like to proceed.
Just give me one moment here.
All right, we can see you now, Dr. Shah.
Yeah, apologies. All right, is that better?
We're getting an echo from you. Will you try muting the sound on your computer if you're using your phone?
Yeah, unfortunately I am, because I'm having some trouble with my, as you can see, I'm having some trouble with my my video. So I am now set to go. So apologies for that.
It sounds great. Do you want me to take it from the top or do you want to dive right into remarks?
I can dive right in.
All right. Thank you.
Great. So good morning, everybody, and thank you for joining us. I apologize for the technical difficulties. as you can imagine, sometimes technology can be your best friend and sometimes your worst enemy. I want to just start by saying that yesterday, we all know we reached an incredibly sad milestone for the state of Washington. Since our first COVID-related death here on February 29th, 2020, more than 5,000 people in Washington have died of COVID-19. Extend my deepest sympathy to all those who have lost a loved one. And we know this is very difficult, not just for those who have been impacted by this horrific pandemic, but also just remembering that as community members, we have lost friends and family members who have unfortunately succumbed to this disease. Today at noon, we are asking folks around the state to take a moment of silence or throughout the day at whatever the right time is to do so and remember all of those who have unfortunately been impacted and those who we have lost. Together we will heal, we will recover. We will never forget those who we have lost, but we have to continue to remember the fight continues for COVID-19 and beyond. So with that, let me shift to a few things and just remind everybody that the pandemic is not over, and there are definitely many reasons for hope for us, but we have to do everything we can to continue to fight this pandemic. Right now, we're seeing positive signs in our data, including decreasing COVID-19 cases, hospitalizations, and deaths. Case rates are still relatively high, but moving in the right direction. As of mid-February, only 9 of our 39 counties had more than 200 new cases per 100,000 people in the previous 2 weeks. That shows steady improvement since January, when most counties had rates that high. Daily hospitalization admissions have flattened out to an average of 13 new admissions per day in Eastern Washington and 39 per day in Western Washington as of mid-February. Both of those numbers show significant improvement since January. But again, as I just said earlier, it is not the time to let our guard down. We must continue to slow this spread of the virus, and concerning even more so is the fact that nationwide, the CDC just earlier this week had indicated that while case numbers continue to decrease across the country, there has been a plateauing or flattening in those numbers, and we want to continue to do everything we can to make sure that we fight this pandemic. In particular, we continue to be concerned about the increasing detection of new variants of the virus. While Washington already ranked in the top states in detecting these variants, this week the Department of Health launched expanded capability of genomic sequencing to identify new strains of COVID-19 with next generation genomic sequencing equipment at the state public health lab in Shoreline. So we have enhanced our capabilities, and this new equipment will process samples of specimens from people who have tested positive for COVID-19 without any additional testing needed. And the goal is to test several thousand specimens a month at the lab, which will continue our place in being one of the advanced centers across the country for this from a public health standpoint, in addition to the sequencing already happening with our partners, for example, at the University of Washington. We have now detected 70 cases of the B.1.1.7 variant, up from 39 last week, and have also detected 5 cases of the B.1.351 variant. Identification of these variants, as you know, is a mixed bag of good news and not so good news. Obviously, we would rather we would not having any variants, and that this virus was not having any changes in its gene sequencing, and that it was not morphing to different kinds of variations. But the good news is that we can detect these through our expanded capabilities. Of course, the not so good news is that these variants are believed to be more infectious and easier to spread, and they are now here in Washington. This makes our race to vaccinate Washingtonians as quickly and as equitably as possible, even more important. With this in mind, let me transition to the issue of vaccines, which I know all of you are concerned about just as we are. The good news is that we have now given more than 1.7 million doses of vaccine throughout the state of Washington. We have administered almost 80% of all doses received in the state, which is a market increase over where we were at 29% in the first part of January. We've also been very close to giving our goal of achieving 45,000 vaccines per day. Our current 7-day average is just over 43,000 vaccines a day. This number, of course, will continually shift, but this shows our continued hard work to date and is a testament to our partners on the ground who've just been working so diligently to make this happen. And I just want to thank them for all their hard work. Additionally, demographic data is now available on our dashboard. You can find the percent of vaccinated people in each age group, as well as a breakdown of race and ethnicity information for people who have received vaccine. And I just want to remind everybody that we need to continue to remember the context of who is eligible for vaccines and making sure that we're making the right comparisons when we look at race and ethnicity data with who has been vaccinated. Vaccinated Washingtonians continues to be a three-legged stool. It includes supply, logistics, and demand. And throughout the summer, there are going to be times we're going to see constant shifting. Right now, the supply is low, but we know that the demand is high. Logistics are certainly at play as well. There will come a point where the supply will increase, and we want to make sure our logistics are just as strong as ever so that we can also handle the demand, but we want to make sure that we encourage all Washingtonians to get vaccinated as quickly as possible when it's your time to be vaccinated. Earlier this week, we announced a change to vaccine eligibility to meet the new federal directive. As you know, President Biden announced that all states must prioritize vaccinations of teachers and childcare workers with the goal of getting these groups one dose of vaccine before the end of March. The federal government has indicated that the federal pharmacy program will be leaned on by states to accomplish this task. To follow this directive, Department of Health has now added pre-kindergarten through the 12th grade educators and childcare workers to Washington's current vaccination phase, which is 1B Tier 1. So we've made that change this week. Vaccinating of educators has always been a priority for Washington. They were in our next tier for essential workers, but not a prerequisite for having schools reopen for in-person instruction. I think we made it very clear that schools can reopen safely in person, even in advance of vaccinations. We're hopeful that this focus, though, will mean that more of our schools can go back to in-person instruction, which we know will help the educational and social development of our kids. Although we know vaccine supply remains limited, I want to reassure everyone who was previously eligible for the vaccine that they are still eligible for the vaccine. That means health workers, those in long-term care facilities, and certainly our seniors. If you are a healthcare worker or someone age 65 or older or above age 50 in multi-generational households, please continue to look for appointments. If you're a vaccine provider, please continue to reach out and support people who are eligible for COVID-19 vaccines. This especially goes for seniors. We want to do everything we can to continue to help our seniors get vaccinated. And that means that we want you to continue to seek vaccines because we know that seniors are most at risk in terms of age risk because of COVID-19 leading to adverse outcomes, hospitalizations, or even deaths. We welcome the news from the federal government that the pace of vaccine availability is increasing. In our current 3-week estimated forecast that we've received, we're seeing a small increase in the amount of vaccine we will receive. Currently, we're at about 300,000 vaccines this and next week. We're hopeful we will see larger increases over the coming weeks and months, especially with President Biden's announcement that he wants to see all Americans at least have access or completing vaccine by the summer. Another development that will make a big difference for our supply is the arrival of Johnson & Johnson vaccines. I can't emphasize enough how exciting this news is. Now we have a third vaccine that is now added to our arsenal. Johnson & Johnson vaccine will help increase our vaccine supply across the state and improve access to COVID-19 vaccines in areas where providers didn't have the capability to store the ultra cold or frozen versions of the other vaccines. In addition, this vaccine requires only one dose, which will help people get protected against COVID-19 without having to worry about scheduling or finding an appointment for a second dose. So this is great news. And I know Lacey Fehrenbach will share some additional information about J&J allocation and distribution in just a few moments. Having a one-shot vaccine such as J&J's vaccine is truly incredible. We now have 3 very effective vaccines coming into the state of Washington. And I do want to emphasize that all of these COVID-19 vaccines are effective at preventing severe illness, hospitalizations, and deaths. In other words, if you are a community member and you're eligible and offered any of these 3 vaccines, our message is do not hesitate. Vaccinate. Please get vaccinated. They will all protect you against this horrific pandemic. And we want to make sure that we emphasize, please do everything you can to get vaccinated. The more vaccine we have, of course, the more we can slow this disease transmission and improve our ability to safely reopen businesses, schools, and really hopefully get out of this pandemic again as quickly and as equitably as possible. Regardless of whether you've been vaccinated, we can all help stop the spread of virus and stop the spread in protecting our families and our communities. Please continue wearing a mask. Please wash your hands, watch your distance, and get tested if exposed or with symptoms. Together, we know we can continue to drive this virus into the ground, but it's going to be up to all of us. And we continue to work with our partners. I want to thank all of them for their hard work. Again, 400 plus days, just everybody doing everything they can to protect Washingtonians is fantastic. And we want to continue to work with our partners and really thank them for their hard work. And with that, I will turn it back over to you, Frangie.
All right. Thank you, Secretary Shaw. Next, we'll go to Deputy Secretary Lacey Fehrenbach.
Good morning, everyone. Thank you for joining us. And thank you, Secretary Shaw. I'm Lacey Fehrenbach. I serve as the Deputy Secretary for the COVID-19 response here in Washington State. As the Secretary mentioned, we found out Tuesday about the President's plan to open COVID-19 vaccine eligibility to educators and childcare workers. We understand the unique role school, early learning, and childcare workers play in supporting our Washington families and children. And we know that these providers have had to make some of the greatest shifts in how they work and how they support our families during the pandemic. Prior to the President's announcements, we'd been planning to open up eligibility to these groups in the near future as part of our critical frontline workers that become eligible in 1B2. This directive just speeds up that process and immediately adds about 260,000 people to our eligibility list here in Washington State. The Department of Health is working with our partners at the federal level to learn more about this program. We're also working with our sister agencies, the Department of Children, Youth, and Families, and the Office of the Superintendent of Public Instruction, as well as our local partners to make this pivot quickly during the week here. And right now, we can say for certain the best place for educators and childcare workers to get the COVID-19 vaccine is through that federal pharmacy program. We've been told by the federal government that the providers in this program will prioritize educators and childcare workers at their sites through the end of March. And here in Washington, we have 6 pharmacies involved in this program. Those pharmacies are getting about 65,000 doses this week and 72,000 next week. This is in addition to the state allocation that we receive. Our six participating pharmacies are Safeway Albertsons, Walmart, Costco, Rite Aid, Health Mart, and Kroger. Based on what we're hearing from the federal partners on the supply to this program, we do believe it will be eligible. We will be able to meet the challenge to administer first doses to those eligible educators and childcare workers in Washington State by the end of this month. I also want to note, as Dr. Shaw did, that the addition of these groups does not mean we are moving beyond those currently eligible. We are still very, very focused on vaccinating our highly vulnerable populations. This work will continue to happen at local sites across the state, our pharmacies, mass vaccination clinics, hospitals, community health centers, and more. So please do not delay. If you are a person 65 or older, or someone 50 in a multi-generational household, or a healthcare worker that hasn't got your vaccine, please reach out and try to get that scheduled today. Each week, we have been able to provide more and more vaccine to our partners across the state. And what's great is that our 3-week forecast continues to improve. As you heard, we're expecting to receive more than 300,000 doses of COVID-19 vaccine. And by late March, we expect to receive about 330,000 per week. Next week's allocation forecast is still about 100,000 doses shy of what our providers are requesting, but we're moving in the right direction. And switching gears from supply to capacity, I want to add my thanks to Dr. Shaw's comments for the tremendous work that our team here at DOH, our private sector and public partners, and all of the providers at the ground level, local public health, community health centers, pharmacies, the National Guard and healthcare systems are doing to build capacity in anticipation of increased supply. You heard that we're very near to our 45,000 dose per day goal. And I want to call out that in 3 of the past 5 days, our providers across the state have administered 50 to 60,000 doses on each of those 3 days. This involves tremendous planning and partnerships among many. And we also know that we are continuing to require patience among those waiting for their vaccine. We are very happy that the Johnson & Johnson vaccine has been granted an emergency use authorization by the FDA and CDC. We have a third highly effective COVID-19 vaccine to help us slow disease transmission, reopen businesses in our state, and get our students back into the classrooms. As we've shared with you before, Washington was allocated 60,900 doses of the Johnson & Johnson vaccine for this week. It's important to us that the counties who are behind get their proportional share of vaccine. So we're sending most of our J&J doses to counties where their allocations were a bit lower in the past. And we've been working with them throughout this week to do that. Unfortunately, we found out from the federal government that we will not receive additional doses of the Johnson & Johnson vaccine for the next 3 weeks. While this is disappointing to hear, we have been told that the allocations will start back up at the end of the month. In closing, I'd like to thank our providers and the public. We know that there have been some big changes that happened this week. We appreciate your flexibility, your help, your patience as we navigate through this. And when it's your time to get the vaccine, please remember the best vaccine to get is the one that's available to you. Vaccination is a critical tool that we need to help bring the COVID-19 pandemic to an end. All 3 of these vaccines are highly effective and life-saving. When it's your turn, roll up your sleeve. Thank you all very much, and back to you, Frangie.
Thank you, Deputy Secretary Fehrenbach. This brings us to the Q&A segment of today's briefing. We do have several media with questions today, so if we're not able to get to your question, please reach out to us at doh-pio@doh.wa.gov. Our first question today comes from Sam with KEPR. Go ahead, Sam.
Whoops, sorry, I couldn't get my microphone working. Thank you so much for taking my question. I just first wanted to start off with, I mean, people here are kind of anxious seeing that Texas and Mississippi are both lifting up their mask mandates. And I just wanted to get your thoughts on what you think of that. And then if you think there's kind of a timeline on when it would be safe to open up here in Washington.
Yeah, thanks for that. And I'm glad you were having technical issues too, because you can see it was very difficult for me to give my remarks while I was holding a mobile phone and trying to give remarks at the same time. So I'm glad that my camera finally started working. You know, as you know, I am quite familiar with Texas, and I will, tell you that what's happening in other states. Obviously, every state has a different reason and a different rationale for how they're going about doing things. I did earlier on social media and Twitter. I did say that I thought it was too early for these states to be going in this direction. And the reason I say that is simply that I've been on the front line of fighting this pandemic in Texas for several waves and several months. And I know how difficult it was to fight this pandemic when we have the challenge of people not wearing masks, or when you have businesses or establishments that are full go. It makes it very difficult for public health to do its job, and our job is to protect people from this horrific pandemic. So, I would say that, I'm sure people in Washington, fellow Washingtonians, are watching what's happening across the country anxiously and saying, well, why not here? Why, if other states can do that, why can't we do that? And that's absolutely why I'm also concerned about this message across the country, because what it does is it actually does put into conflict those states that I believe are really trying to be as careful as possible and to do everything they can to protect their residents. And now you have, additional narratives that are out there. And so it becomes very confusing to people. I think the message is really, at the end of the day, we are following what we believe is best to help Washington through this pandemic. We do not believe this is the time to lift mask mandates. This is not the time in Washington to go aggressively with reopening. We do feel that variants, and remember, I've already talked about the increase in variants. We do believe with the up and down, with the shifting of vaccines and supplies and other aspects of this, that there are just a lot of things that are still unknown. And what we don't want to do, and what I think is really, really difficult, is that when you dial up very quickly or dial back, that actually is a ping pong effect that's not good for people either. And so we want to be very methodical as we think about the road ahead. So with that, I would just say that, look, we're paused right now in phase 2. That means that we're not going back to phase 1. We're also not moving forward to another phase. And what that really gets us to is really taking the considerable and considerate time it really requires in order to make good decisions about what the path forward is. So I hope that helps in answering your question. I just want to be as authentic and honest with it. But I am concerned about the narrative across the country, especially when you have CDC saying that we're seeing a flattening or a plateauing of the diminishment of cases. It's not going in the exact velocity that it was previously. So we just have to make sure that we remember again that we're not out of this pandemic.
I'd like to just add to Dr. Shah's remarks. Here in Washington, we're seeing a similar slowdown of our declines of disease in terms of cases. And I want to point out to people, we're, to use a sports metaphor, I know Dr. Shah likes them, we're in like mile 21 of a marathon right now. And the finish line is there, and it's not time to slow down or give up. We've got to go through to the finish. We're making extraordinary progress with vaccinating people across our state. Right now, we have about 15% of Washingtonians that have received a first dose. That means that 80 to 85% of us are still susceptible to COVID-19. So we have got to keep up our efforts on masking and distancing, because we want to stay moving forward on reopening our economy, getting more kids in school. We don't want to go ahead too fast and then have to go back. So let's all keep going forward together. Let's get more people vaccinated and keep doing what you're doing, Washington.
All right, thank you. Our next question comes from Whitney at KREM.
Hi, thank you. My first question, I have a two-part question, if that's okay. The latest update from your department shows that Spokane's mass vaccination site here at the arena is actually vaccinating the fewest people of all the 4 mass vaccination sites in the state so far. So why are we consistently lower than places like Wenatchee or Tri-Cities when our population is still considerably higher?
Lacey, you want me to, why don't you go ahead and you can take it.
So I first want to start by saying these sites are one of many places we are deploying vaccine. We have a multimodal approach. It includes those mass vaccination sites that we run in partnership with locals. It includes mass vaccination and mobile clinic sites that local partners run. It includes pharmacies, community health centers, and other providers. Spokane, relatively speaking, is doing well in terms of vaccination efforts. The differences in capacity have many factors contributing to them: the layout of the space, the number of staff there, et cetera. Our goal is across all of our providers to vaccinate as many people as quickly and as equitably as possible.
Okay, thank you. And the second part of my question is really just to kind of address the frustration here that exists in Eastern Washington about trying to get appointments. And so ever since the Department of Health took over the arena site, we really haven't gotten any information about when the site will be able to reopen for first doses. Right now, they are focusing just on second doses. We also don't know how people are going to be able to schedule those appointments when they do open up. So why are we not getting that information, and when do we think that the site will be able to reopen for first doses?
Let me let Lacey answer the when, but let me go to what you just talked about, which is communication. And I absolutely agree with you. If you feel and the community in Spokane feels that they're not getting enough information about the Spokane site and the information, we're going to work on that. We need to improve that. As you know, and you know this because you're in the media, communication is a two-way street, right? So we may be thinking that we're communicating enough, but we're obviously, from your comment or question, it appears we're not communicating enough in a way that is being received by the community members. So we can work on that, improve on that. And the good news is on this press briefing, you have our Department of Health communications team on. So they're hearing me say that. So we can work with you and maybe even connect with you and just ask what specifically you're hearing or seeing. And we can then utilize that in a way that's going to help us communicate what's happening at the site and how people can get appointments and even the first and second dose question that you were asking. So thank you for that. And, I just want to take that on directly because this is one of those very difficult issues, is that in every emergency I've been in for 20 years, communication, and you just can't emphasize it enough. So thank you for bringing that up. And Lacey, did you want to make a couple comments about the second dose? Or she answered?
Yes.
Yeah.
So we have been, so we're in the process of doing our allocations for next week and planning out weeks beyond that. We are thankfully getting close to resolution of our second dose challenge that we were experiencing statewide. It was not unique only to that site or Spokane as a county. We were statewide needing to take Moderna first doses and use them as second doses to balance, a allocation challenge that followed the 4-week period from late January, where a large volume of Moderna doses came into the state. And most of our providers used both their first and second doses as first doses. So the good news is we have been, you are accurate, we have been prioritizing second doses the past few weeks, and that has meant very limited first dose appointments, including at our state-run and state-supported mass vaccination sites, but broadly across the state among all providers. We do think that we are turning the corner in that regard. We certainly want to be very transparent and public with and in good communication with the public, as Dr. Shaw said, about when first doses will be available at that site again. And certainly, we're also in a transition. We've had a great partnership with Chaz. We are converting that partnership to be a Safeway supported site. And we will make sure that people have advance notice and tools that they need to register for first dose and second dose appointments as that transition occurs. And Sheehan, if you want to add anything, you're welcome to.
Yes, please. Thank you. So I just wanted to go back to your first question about the Spokane mass vaccination sites and remind you that each of those sites have the capacity to administer about 1,500 doses a day. Oftentimes we are seeing the supply limitations, and so we're not able to allocate out enough doses for the week to those sites. But as of yesterday, the data shows that Spokane Arena has administered 18,299 doses. And then the other sites range all the way up to like just under 24,000 doses. And so Spokane has an extremely high throughput. I think there might be days where the allocation of the vaccine was just lower. And so that's why we're not seeing their numbers as high. But as of yesterday, all 4 sites were close to 1,500 doses administered. So great work at those 4 sites and really can just expand that capacity as we get an increase in supply. Also, the Spokane site will be starting up the next rotation of Moderna vaccine. And so they will be switching over to the first dose or offering the first dose. And so you should see that switch happen in the next couple of days.
All right, thank you. Our next question comes from Jefferson with NCW Life.
Hi, thank you for taking my question. I appreciate it. With the governor's order and the directive of the president, we have school staff, childcare workers, and educators all added to this tier. In response, our local health district here in Wenatchee set aside some doses for those workers, and the first step in their instruction was for those clients to first check their eligibility on Phase Finder. However, Phase Finder does not, as of this morning, ask about your educational employment as a criterion for vaccine eligibility. The health district also asked vaccine clients to show their school ID or badge, but this is not always something a childcare worker, for instance, is likely to have, and there are other non-traditional classes of educator like extracurricular arts instruction, music lessons, private tutors, dance instructors. And those folks can have as much exposure to young students as a public school district employee does, but they are not going to have those documents most likely. My question is, what should those educational and childcare workers do to obtain their vaccinations? What do they need to provide? And how soon do you think they could expect more clarity?
Sorry, Jefferson, I just wanted to say thanks for bringing this to our attention. I will say, this is the challenge that we are going to continue to have through the end of this entire vaccination process, which is unexpected pivots. And that's exactly what happened. And so, we were not anticipating to make this pivot this week. Nobody was across the country. It happened because, as you said, of how things played out. So, that means that sometimes when you make those changes, that the immediate is that it takes a little bit of time to get all the systems go. And we are absolutely committed to making sure those systems smooth out over time. But the moment you say go, they're not always as ready to be able to take all those things on because you just were not anticipating that. That's why we really ask throughout the patience of our Washingtonian community members, and they've been fantastic, our partners who've been fantastic, but it really is about patience because things will always change. And we know that right now it's a supply change, a limitation, it's a logistics issue, and it's a demand issue. Those 3 things, and then you sprinkle on top of a change of pivoting of who's eligible in a very quick fashion, and that can all of a sudden throw things into a different category. And so that's what we're really working on. And so Shan or Lacey, I don't know if you wanted to add anything about Phase Finder in particular. I know we were making some changes to it, but just wanted to highlight.
Oh, I can add, thanks for raising it. We did update it, and I actually personally myself checked it Tuesday evening, the night of the announcement. So we have a team already right now looking in to see if something has gone awry there. But our understanding is it is updated to reflect this change in eligibility for educators and childcare workers. And those updates were available in English and Spanish Tuesday evening, and then the remaining languages yesterday. But we will make sure something there hasn't been a glitch in the matrix, so to speak. In terms of your question about childcare workers, we actually have been working with the Department of Children, Youth, and Families to provide cards that are essentially a letter indicating that a person is eligible as a childcare worker. And the Department of Children, Youth, and Families has ways to get that out to the groups that are eligible. And those include licensed family home childcare providers, as well as those center-based cares, licensed exempt family, friend, and neighbor care providers that accept working connections, the child care subsidy, the Early Childhood Education Assistance Program, that's Washington State's funded preschool providers, known as ECAP in our state, and licensed exempt school age and youth development providers who have been providing care to school-age children since the pandemic started, and schools have been primarily closed or in remote learning. So those groups will be getting communication through likely their employers or directly from the department that will help them with eligibility and tell them about this program. I also want to note there are a number of local partners, including some that you mentioned, that are doing direct outreach to these groups, whether it's schools or childcare workers, to help them get their appointments and their vaccine.
Thank you. Our next question comes from Tom with Public Radio Olympia.
Thanks for taking my question. I had noticed one other milestone on the vaccination dashboard yesterday that I thought was interesting, that the seniors, the 65 plus group now is at 50% having initiated vaccination. Can you talk a little more about what the threshold is to see for that group and maybe now the educators childcare cohort as well, before you would entertain actually going to the full phase 1B tier 2?
Yeah, thank you. I'll start, and Lacey or Shan may want to add to this. And Tom, thanks for that question and great observation. We did say that at about 50% we would really be looking at beginning that process of evaluation for moving to the next tiers. But I will say one thing, which is that we know that actually two things. We know that seniors are a particular risk of if they get infected with COVID-19, that they are at risk for severe illness, hospitalizations, and really our concern is a really bad outcome. And what we want to do, so that's the first thing. The second thing is the fact that we also recognize that we've had challenges with seniors being able to get appointments, right? Being able to go online, or even if there are telephone options to make the call, or to have to rely on a family member or a friend or somebody in the community to help to try to get appointments. We have not, as we're talking through both internally as well as with our partners, we have not heard by and large, although there are some communities where, smaller jurisdictions that are saying, hey, we're pretty close to being done with our senior population. But for the most part, we're hearing across the state that seniors are still trying to get their appointments. And so that is so critical for us, because as we continue to have, remember, supply, logistics, demand, as we continue to have demand, and we know that this is a group that we particularly want to make sure we take the time to be able to get as many vaccinated as possible before we open up to the next tier for essential workers. we want to do whatever we can. So it's not a straight threshold of a percentage is what I'm getting at. But I will say that very soon you will hear additional information about how and when we're going to be moving to those next tiers. But right now it's really about, we want to continue to stay focused on health workers, long-term care facilities, those who are seniors, obviously multi-generational households above age 50, and now with our educators. We want to make sure that we continue to emphasize who's eligible and try to get as many vaccinated before we open up our next groupings.
All right, thank you. Our next question comes from Anna Boyko-Wyrock with KUOW.
Hi there, thanks so much. Speaking of long-term care facilities, I'm still interested in data on vaccinations in long-term care facilities, and I asked this last week. I still haven't gotten an answer. But Dr. Shah, what was the last day that you yourself saw an update on the exact numbers of long-term care facilities that have been vaccinated in the state, and how many remain?
It was actually just a couple of days ago, but now you asked me two questions. One was when I saw it, and the other is what those numbers are. And the problem is that my recall of those numbers isn't always as good, and so that's where I rely on my team. So Lacey or Shan, do you have any of the updated numbers for Anna that might be helpful? Or we can get them, I guess, if we don't have them right handy.
So we do capture the doses given in long-term care facilities. Right now, we're not sharing some of this information publicly because there is the potential to identify some providers and facilities. So we know this is an area of high interest. We know that people are eager to know this. The good news is we are making great progress in vaccinating those people in our long-term care facilities. And we thank everyone working to get out to these vulnerable populations, whether they are doing that through the federal CVS Walgreens partnership. So those partners, as well as some of the local mobile clinics that are going adult family home to adult family home to vaccinate our most vulnerable populations.
This is Shan, just to add to that. I know, like Lacey said, we do have some mobile teams that are going out, finishing up the very few adult family homes that are left to receive first doses. I think I can go back to the team and gather some just data that we can share out. But I know that on a recent update from the CDC that Walgreens and CVS are just about wrapping up their program. They would expect that to be wrapped up by the end of the month for those that were enrolled in the federally long-term care pharmacy program, if not the week before the end of the month. So that portion, I think, is, they've really moved quickly in the last couple of weeks and are going to meet that 18-week goal that they had set in place at the very beginning. And then for those that didn't enroll, that the Department of Health and local health jurisdictions and the pharmacies are assisting. I know that we are extremely close to administering or offering at least the first dose, if not the second dose, to many of those facilities.
And then do you have a plan for vaccinating new residents and staff as they come into these facilities?
Yes. So I didn't mean to just give you a one word answer, but yes, I mean, it's, we in all of these, let's just back up, right? You've got health workers who have to continue to have ability for new health workers coming into the system to be vaccinated. You've got seniors, somebody that, a month ago was 64 years old and now they're 65 years old, for example, or long-term care facilities, as you mentioned. So we continue to not just open up additional tiers or phases, but what we also want to do is make sure that we've talked about it as the ability when you're boarding a plane, that it's not like, the people in the front of the plane can't can't board out, with somebody in the rear of the plane, or now they do it opposite. The people in the rear of the plane, they board first and then they move forward. But it's just that we want to make sure that it's that regardless of which phase we're in, that the previous phases or previous tiers can continue to vaccinate or be vaccinated. But then to your specific question, with long-term care facilities, again, it's just working with our partners to make sure if there are new individuals, new employees that need to get vaccinated, how to go about actually vaccinating them so that they're also protected, and then certainly protecting the people that they care for.
All right, thank you. Our next question comes from Jessamine McIntyre with Q13.
Hi, thank you all so much for your time. Very much appreciate it, especially every week. Can I ask you if you did request the full allocation of Johnson & Johnson, the 60,900?
So, Lacey, I'll let you answer that. What we did actually was, and I think Lacey mentioned this, that our goal was initially to work with those counties that were behind to use the J&J vaccine to be able to help them, quote unquote, catch up. But in addition to that, what we were also doing this week, so that was Tuesday ordering, so we were going to get vaccine into those counties or communities today into tomorrow, for example. But then now what we're doing is taking an additional look at where else, especially with the K through 12 now being added and some additional shifting that's occurred with that change. We wanted to be careful not to utilize the entire allocation, because we also then heard, which initially, this has been one of the concerns that we had, was that initially with the 60,900 J&J vaccine that was coming in this week, we were under the impression, and we were actually under a good, from our planning standpoint, in a good regimen, thinking that we were going to get thousands of vaccines similar next week and the following week from J&J cash that was coming into Washington. And then we learned that this was it was a bolus one-time 60,900 until I believe it's March 29th, if I remember correctly, that we won't be getting, and Lacey and Shan can correct me if I have that wrong, that we're not going to get the next dosing, maybe either the 23rd or the 29th, the next dosing of vaccine for J&J. And so that's why we wanted to be really careful with this 60,900. But now that as we have a better feel for what's happening with teachers and educators and the K through 12 with childcare, and we're also now having a better roadmap of what is not coming in the next 2 weeks, that gives us now the ability to order more vaccine and then working with our providers to get the vaccine ordered to them appropriately. So Lacey, Shanna, I think it gave a high level, but if you have something you want to add to it, or even specific in terms of about half or a quarter or whatever it is of the vaccine that was ordered.
Yeah, I can give an update of where we're at with that 60,900 doses. So we did place the first portion of the order on Tuesday, and that was for about 15,000 doses to 4 different counties. We've had a lot of excitement and a lot of our local health jurisdiction partners requesting the vaccine. But like Dr. Shah said, we at first were looking at really reaching out to those counties that were under pro rata or that weren't at the proportion that we want them to be based off their county size. And so reaching out in partnership with the local health jurisdiction to identify where doses should be placed. That was the big priority for up until yesterday. It's still the priority. And but I think now we are over 32,000 doses have been requested from those counties that haven't been identified as needing additional vaccine. And then now reaching out, or actually we have a lot of requests from all over the state for these doses to be allocated towards educators, staff, and childcare workers. And so just a reminder that this week's allocation gets us through Saturday. And so then the next week starts on Sundays. That's when the weeks are identified. So I have no fear that we will have all of those doses allocated out by Saturday. I mean, the demand is there, and we understand the importance of distributing vaccine across the state.
Thank you. Our next question comes from Ted Land with King 5.
Hi, and thanks for your time. I have a question about monoclonal antibodies. I spoke with a patient who said, he had a relative who recently was tested positive for COVID, and the clock started ticking, and he knew to go seek this treatment for his relative. But calling around to doctors' offices and clinics, he kept running into dead ends because people didn't seem to know what he was talking about, or didn't know where to direct him to go to get this treatment for his relative. I know that others are able to get the treatment. This is just one case, but do you think that there's an appropriate awareness level of this treatment throughout the health system in Washington, particularly, the frontline people who answer the phone, who are having the most contact with patients? And then can the state do more to promote monoclonal antibodies and speed its administration for people who are still testing positive for COVID and are not vaccinated yet?
Yeah, and Ted, thanks for that question. I'm going to let Lacey talk about that in more detail. What I do want to say is you bring up a global point that I would like to emphasize, which is everyone is so focused, rightfully so, on vaccines. We cannot forget all the other modalities that are absolutely critical to continuing to do and fight and take on, that we as a department and our local partners have been doing for 400 plus days, which is all of the testing and all of the contact tracing and the epidemiologic investigation pieces that go along with that, and then all of the treatment modalities. We have seen some fantastic decreases in our hospital system, our healthcare system. That does not mean that we can just stop and rest on our laurels. So, I do think that that's one key point globally. And the other key point is that really there are a lot of reasons for us to, because of the variants and also because of the trajectory decline plateau, if you will, that slowing down is also an absolute reason why we need to do everything we can to promote the wearing of the mask and all the preventive measures, staying out of crowded areas, and obviously watching distance and washing our hands, and to get tested, because ultimately testing then determines how we can further interrupt transmission. So I just want to globally say that that's absolutely critical for the way that we have been really looking at this, and that's why public health has been so strained across the system in the country, because while we're still doing all of those things, we are now also handling vaccines and vaccinations. And that's been a real challenge across the country. And again, that chronic, and hopefully you can help us, Ted, with this messaging, that chronic underinvestment in public health over the decades across the country. And obviously that's no different even in the state of Washington, that we can do a lot more to make sure that we're capable and have the capacity, not just for this pandemic, for emergencies beyond. So with that, Lacey, I'll turn it to you for the specific questions about monoclonal.
Yeah, it's a good suggestion, and some of the things that we have been trying to do to increase visibility and awareness about the availability of monoclonal antibodies for those people in particular who are at risk includes work with the long-term care facilities and adult family homes, and in particular, those that may have populations that are not vaccinated, or if they have residents that chose not to be vaccinated, collaborating with some of our partners like the Hospital Association and DSHS to make sure they are making visible these therapies. And then I we do have some information on our website, and certainly we can work more on social media and other venues to put that out there and make it visible. But yes, there is competition for messages, as Dr. Shaw mentioned, and there is a possibility that people are so focused on the vaccine they're not thinking about treatments. And we certainly want people to have all the tools they have, to prevent getting sick in the first place, but to have access to treatment if they do get sick.
All right, thank you. And now we will go to Secretary Shaw for closing remarks.
Well, thank you, Frangie, and thank you, Lacey and Shan, for joining in. And again, apologies to all of you because of the technical issues I was having with my camera. It seems like it happens every time that you're going on something that's very meaningful. All of a sudden, the technical issues start. But I just want to say thank you to all of you. We know that Washington continues to focus on vaccines. We have to remember that it is not just about vaccines, it's about everything that we need to do to continue to fight this pandemic. We also recognize, though, that vaccines are an incredibly important tool because we know this is our way out of this pandemic. We've got now 3 highly effective, safe vaccines that are available to us, and we're going to do everything we can to get those into the arms of Washingtonians. That also means that we're doing everything we can from our state level to talk with our federal partners to do everything we can to get support from our federal partners, and then just continuing from a state level to support what's happening with our local partners who just are doing an amazing job, both in the public and private sector, to vaccinate as quickly and as equitably as many Washingtonians as possible. But we have a lot of work to do, and we've got a lot of pivots that are going to be happening and a lot of unanticipated changes and challenges that will come up over the next several months. But I'm confident together we are going to be able to achieve our goal of vaccinating Washingtonians and to end this pandemic. And so I just want to thank you, our media partners, for championing those messages. And I also appreciate the couple of questions that were about some of the things that were about communications. And please continue to let us know there are things that we can do to improve that. We will absolutely do that, because ultimately it's about working, as I say, #in it together. So with that, if it's your turn to get vaccinated, do not wait. As Lacey said, if that vaccine is available, get that vaccine, because you are absolutely going to be protected from this horrific virus. So with that, thank you so much. And Frangie, we'll turn it back to you to close.
Thank you, Secretary Shaw. Well, this concludes today's media availability. I'd like to thank our panelists for their time today, and TPW for hosting today's live stream and archives of past briefings. Thank you all, and take care.